What is a cystoscopy procedure, and how does it work? Imagine getting a close-up look inside your bladder without surgery. That's what a cystoscopy allows doctors to do. It's a common and important test used to examine the inside of your bladder and urethra. The procedure involves inserting a thin, lighted tube called a cystoscope through your urethra, which is the tube that carries urine out of your body. This tiny tube has a camera and light attached, so your doctor can see the inside of your bladder on a monitor. There are two main types of cystoscopes. The flexible cystoscope is a thin, bendable tube that's usually more comfortable and often used for diagnostic purposes. It's typically done while you're awake and requires only local anesthesia or numbing gel. The rigid cystoscope is a wider, non-bendable tube that might need anesthesia or local numbing. It's often used when the doctor needs to perform treatment during the procedure, such as removing small stones or taking tissue samples. Before the procedure begins, your healthcare provider will clean your urethra and apply a numbing agent to reduce discomfort. Then, they gently insert the cystoscope through your urethra into your bladder. To get a clear view, the doctor will fill your bladder with water or saline solution. This causes a sensation similar to needing to urinate, which is normal. The doctor then examines the inside of your bladder and urethra, looking for any abnormalities like tumors, stones, or signs of bleeding. If needed, the doctor can take a small tissue sample called a biopsy for further testing. Sometimes, they can also perform minor treatments during the cystoscopy, such as removing small stones or placing a stent to keep the urethra open. Cystoscopy is especially useful for diagnosing issues related to bladder health. It helps identify causes of frequent urinary infections, blood in the urine, or symptoms that might suggest bladder cancer. For patients with a history of bladder cancer, cystoscopy is a vital tool for monitoring and detecting any recurrence early. It's a safe procedure with a low risk of complications, and it provides valuable information that guides treatment decisions. Always remember, if you have symptoms or concerns about your bladder health, consult a healthcare professional. They can determine if a cystoscopy is appropriate for you and guide you through the process safely.